Welcome back. I'm Dr. Connor Oliveri, and today we are focusing on the thoracic spine, the mid-back. This is the most overlooked region of the spine, and in my experience, it is also the most important. Here is why. The thoracic spine connects the neck above and the lower back below. When it loses mobility, which it does in almost everyone who sits for long periods, both the neck and the lower back are forced to compensate. This means that many cases of chronic neck pain and lower back pain are actually being driven by thoracic stiffness. Unlock your mid-back, and you will often see dramatic improvements in pain you thought had nothing to do with this region. The thoracic spine is designed to flex, extend, and rotate. It has 12 vertebrae and is the most stable region of the spine because it is anchored to the rib cage. But that stability comes at a cost. It is also the region most prone to stiffness when movement is restricted. And modern life restricts thoracic movement constantly. Sitting at a desk, driving, looking at a screen, all of these activities hold the thoracic spine in a flexed, compressed position for hours at a time. The result is what we call thoracic kyphosis, an exaggerated rounding of the upper and mid-back. This rounding compresses the anterior portion of the thoracic discs, restricts rib cage expansion, which reduces breathing capacity, and forces the head and neck forward, creating cervical compression. It is one of the most common postural findings I see and one of the most impactful to address. Exercise number 1 is the foam roller thoracic extension. This is the most effective exercise I know for restoring thoracic mobility quickly. Place a foam roller on the floor perpendicular to your spine. Sit in front of it and lower your mid-back onto it, starting at the level of your shoulder blades. Cross your arms over your chest or interlace your fingers behind your head. Allow your head and upper body to gently extend over the roller toward the floor. Breathe deeply and let gravity do the work. Hold each position for 10 to 15 seconds. Then shift your body slightly so the roller moves to the next segment of your thoracic spine. Work from the top of your shoulder blades down to the bottom of your rib cage. Repeat the entire sequence twice. You may hear popping. That is normal. That is mobility being restored to stiff joints. Exercise number 2 is the quadruped thoracic rotation. Get on your hands and knees with your spine in a neutral position. Place your right hand behind your head with your elbow pointing out to the side. Keeping your lower body still, rotate your right elbow up toward the ceiling as far as you comfortably can. Follow your elbow with your eyes. Hold for 2 seconds at the top of the rotation. Return to start. Repeat 10 times on each side. This exercise specifically targets rotational mobility in the thoracic spine, the movement that is most lost in people with mid-back stiffness. Exercise number 3 is the cat-cow mobilization. Get on your hands and knees. On your exhale, round your entire spine up toward the ceiling like an angry cat. Tuck your chin, round your upper back, tuck your pelvis. On your inhale, drop your belly toward the floor, lift your chest and tailbone, and look slightly upward. Move slowly and deliberately through the full range of motion. Repeat 10 times. This exercise mobilizes the entire spine from the cervical to the lumbar region and is one of the most effective warm-up movements you can do before any exercise session. Exercise number 4 is the scapular wall slide. Stand with your back flat against a wall. Place your arms against the wall in a goalpost position. Elbows at 90 degrees, upper arms parallel to the floor. Press your entire back, head, arms, and elbows against the wall. Now, slowly slide your arms up the wall toward the fully extended position overhead, keeping everything in contact with the wall the entire time. If you cannot keep your arms and lower back on the wall, you have found your end range. Hold there for 2 seconds. Slowly return to the start position. Repeat 10 times. This exercise reactivates the lower trapezius and serratus anterior, the muscles responsible for pulling your shoulders back and down into correct alignment. Exercise number 5 is the open book stretch. Lie on your side on the floor with your hips and knees bent at 90 degrees, knees stacked. Extend both arms straight out in front of you at shoulder height, palms together. Keeping your knees stacked and your lower body still, slowly rotate your top arm up and over toward the floor on the other side, following it with your eyes and allowing your chest to open toward the ceiling. Hold at your end range for 5 seconds. Return to start. Repeat 10 times each side. This is one of my absolute favorite exercises because it simultaneously stretches the thoracic rotators, opens the chest, and mobilizes the shoulder, all in one movement. Your mid-back protocol, foam roller extension, quadruped rotation, cat-cow, scapular wall slides, and open book stretch. Total time, 10 minutes daily. This protocol alone has eliminated mid-back pain in hundreds of my patients. Stay consistent, and I will see you in Module 4 for the lower back pain protocol.